19-year-old Jeffrey Nichols was fatally shot by Howard County Police in November 2011. They got a call to an industrial park for a man with a gun who'd fired at a vehicle. They said he refused their command to drop it.
We had multiple officers who pursued him, got out of the car. There was a confrontation here at this location. He refused to drop the weapon, and our officers fired multiple shots, striking him.
In fact, police records provided to the I-Team by Nichols' father show Nichols was actually unarmed by the time he was shot. Not disclosed at the time, an officer first hit Nichols with his police car, which knocked the gun out of his hand. But other officers didn't know that. The officer driving the car said, "I was able to see that when I struck the subject that the gun came free from his grip. I was unable to get on the radio due to the crash into the retaining wall and my position inside my vehicle." His arm now broken, Nichols went into a ravine. There, other officers shot him 10 times, twice in the back. Still thinking he had a gun, which turned out to be a BB gun, he wouldn't drop. The incident was cleared as a justified use of force. Jeffrey Nichols suffered from bipolar disorder, so advocates for the mentally ill say it may have been impossible for him to rationally comply with the police order.
Well, if someone is in a crisis, sometimes they cannot respond.
Kate Farrenholt is with the National Alliance on Mental Illness, a leading voice for more effective training of police who must answer calls for people in crisis.
How do officers come into a situation and lessen the opportunities for the situation to escalate?
The state requires basic training of police in Maryland to include emergency medical care and crisis intervention. But there is no mandate for a minimum number of hours or for in-service training. That's up to individual police departments. Baltimore County Police have 2 crisis intervention teams, the preferred model of mental health advocates. But neither was available the day County Police responded to a street in Parkville where they found 23-year-old Ryan Dietrich, also bipolar and an alcoholic, in the middle of the street with a knife he wouldn't drop. Police shot him 11 times, killing him. And 19-year-old Seth Beckman, unarmed and under treatment for depression, was shot and killed by a Harford County Sheriff's deputy in 2013. He'd acted out one Saturday night and broke into a snowball stand. The deputy ordered him out, witnesses say, and shot him twice when Beckman ran towards him and the deputy tripped over the curb.
I need to say as a mom that my son that day wasn't acting, the way sanely. But the officer really is the person who's trained. They're supposed to be the professional.
Harford County uses an 8-hour course to teach trainees to deal with mental health calls. About a quarter of its force has more complete crisis intervention training. Commanders say the agency is too small to do more.
We would prefer right now to have a smaller core group of individuals that we can support as opposed to having every individual in the agency trained, which quite frankly for us would be a little cumbersome.
Statewide, between 2011 and 2016 year to date, 108 people have died in encounters with police, according to information provided to us by 26 police agencies. How many were people in crisis? Hard to know. Some agencies won't disclose, citing privacy concerns. Others don't keep track. For the 11 News I-Team, I'm Jane Miller.